memorial oration. On behalf of our team, our General Secretary Durga Prasad Rao, our convener Dr. Sampath Rao, our co-convener Dr. Venugopal Gauri, our revered advisor Dr. Shivashankar sir, and our advisor Dr. S.K. Vashisht, and all the team members on their behalf, I extend a warm welcome to the guest of this evening, Dr. Sai Vivek Areti. Hearty welcome to Vivek and all the audience and all the dignitaries amongst the audience. And today, so we are organizing Veni Bhushan Memorial Oration. So this is sponsored by the family of Veni Bhushan, Dr. K. Shivashankar sir's son, he is beloved son. So he was born in the year 1970, December, and he was a very bright student, and he was studying in Usmani Medical College. So at 18 or 19 years age, he had a premature death. So we extend our heartful homage to the departed Sai Vivek, and we also heartfully thank the family of Dr. K. Shivashankar sir and Mr. Purushottam, Shanti, and Sai Vivek, and all the family members of the family. So Sai Vivek was a very brilliant and intelligent student. So he stood in 48th rank in MCET examination for selection of medicine. So he joined in Usmani Medical College. So in his memory, this is being organized for the 18th year. This event is being organized by their family. So many eminent people have addressed this on this occasion in the past several years. So hearty welcome to you, sir, Dr. Shivashankar sir. So I request all the participants to be keenly hearing the lecture. So we have a very useful topic today, and on Omicron, Boon or Bane. So this is a very hot topic. So each one of us will be immensely benefited by hearing this topic. So I extend warm welcome once again. Thank you.
Thank you, sir. Now I request Dr. K. Shanmugapriya to introduce our speaker, Dr. Vivek Areti, sir.
Good evening, everyone. So it gives me immense pleasure to introduce our speaker for today, Dr. Sai Vivek, sir. So Dr. Sai Vivek is a consultant homeopath and a general practitioner at Vikrampuri, Secunderabad and Nizampet Road, Kukatpalli. He has experience of 5 years in these fields. Dr. Sai Vivek practices at Shanti Homeo Global Clinics in Secunderabad and also has his own setup in Nizampet, Kukatpalli, which was inaugurated in the year 2018. Dr. Sai Vivek completed MBBS from Kaminini Institute of Medical Sciences, Narketpalli in 2014 and has done his degree in integrated medicine from Royal London Hospital in the year 2016. Even though our speaker completed his degree in mainstream medicine, he was impressed by the various cases being treated with homeopathy at Dr. Shivashankar sir's clinics and got inclined towards it. Further, he was also impressed by the treatment strategies which produced absolutely no side effects when compared to the conventional medicine. Apart from being a member of Andhra Pradesh Medical Council and Indian Medical Association, Dr. Sai Vivek is also a member of Faculty of Homeopathy. So now I request our speaker for today, Dr. Sai Vivek sir, to start the session.
Thank you for the introduction, Dr. Shinmuga. I hope I'm audible to everyone.
Yes, sir.
Good evening, everyone, doctors, elders, and all my fellow homeopaths. It is a great pleasure for me to be able to speak about something which is the current hot topic. Most of you know me. I know many of you here personally since I was really young, and most of you are like a family to me. Of course, we all are one huge family with a common mindset. As I mentioned earlier, in a few orations previously, that learning homeopathy and now treating patients with homeopathy gives me great pleasure, and the wonderful words from the patients after they get cured makes it worthwhile. And it makes me really happy to be able to deliver this talk. Although we are unable to have this meeting at HMAT, I feel Zoom shouldn't be a problem because the topic is really interesting. Please correct me if I'm wrong anywhere during the talk. And I might not be talking conventionally, but I'm sure to keep all of you engrossed. I would sincerely, with my whole heart, like to thank my grandfather, Dr. Shivshankar Garu, without whom I would not have been half the person I am today. I completely give all of this credit to him. He is an inspiration. He will be an inspiration to me. And I'm pretty sure that he is to so many doctors over here. Thank you is again a very, very small word. Thank you so much. So, coming to the topic, Omicron, a boon or a bane? Um, can you give me access to the screen? Share. Just 1 second.
Dr. Vivek, you can just share your screen. It should be just possible.
Yes, sir. Yes, sir. Sure. Sure. Okay. Is it visible?
Yeah, very much.
Okay. Thank you. Okay. So Omicron, a boon or a bane? With the rising number of coronavirus Omicron cases reported across the globe, causing a third wave of the pandemic in India, it might very soon be replacing Delta as the dominant global variant. The trend was already visible in the US, where Omicron has taken over Delta as the dominant strain. So, how should we see this? Many might be have argued that the rise of Omicron is not a bad development as of now, and it might mark the end of the pandemic. The Omicron variant, according to the latest information, is a lot less virulent than Delta, so the fatality rates might be reduced. On the other side, there is a threat of hospitals being overpowered if they face this rush of patients if they are becoming more. Also, the Omicron is not common cold. The center has already stated last week and stressing that more and more people need to take the third wave seriously and to observe appropriate protocols. Okay, so what do the doctors and experts say about this? So I've read recently about this doctor called Dr. Jacob John, who is India's top virologist. He says that we don't know whether Omicron will end the pandemic or if it is a detour. We are clueless as to whether Delta is going to disappear or whether Delta and Omicron will simultaneously co-circulate. So the lucky ones will get Omicron first and have good immunity against Delta. The unlucky ones will get Delta first, and these are all the probabilities. We can't make any assumptions right now. This is what he said. So as per this statement, in a way, Omicron is a boon in one manner, infecting a whole lot of people without too much of an economic devastation, right? So, but Omicron will spread faster with very little consequences except for the elderly population and people with comorbidities. However, the rest of the community will be protected against Delta, as Omicron induces good immunity against it. Meanwhile, it is a bane because obviously it is causing devastating infections, which are again widespread all around the world. Okay, so Omicron has far too many mutations. You all might be knowing about it. You all might have read about it online or through articles. It is not derived from the original coronavirus directly, right? So neither has it originated from alpha, beta, gamma, delta, or any other known variants right now. So it raises a question: how did Omicron acquire so many mutations? It still remains unknown to the scientists. So Omicron is challenging scientists, and it is telling that we are missing something, right? So WHO has warned that more than half of Europe's population will be infected with Omicron in the next 2 months. Omicron causes milder symptoms when compared to Delta and other variants, but we cannot afford to be complacent. This highly mutated variant is also affecting the children and is sparing no one. So what is more concerning is that almost all kids, so we are observing this in our clinics daily too, that the kids who are in contact with the elders also are getting infected, which again emphasizes how infectious Omicron variant is. We are 2 years into this widespread pandemic fatigue that Omicron almost feels like a good news. So that feels like a proper introduction to this upcoming vast yet concise explanation of the newest variant of coronavirus we're going to discuss today. Please bear with me. It is a slightly lengthy discussion, but I hope to keep all of you engrossed. So let us dive right into the topic without any further ado. So these are the table of contents which I'm going to discuss today, which is introduction, the clinical case, the treatment, the discussion, and how about the monitoring. So how did the Omicron variant develop? When a virus is circulating widely and causing numerous infections, the likelihood of the virus mutating increases. So Omicron variant is a variant of SARS-CoV-2, which causes COVID-19. This variant was first reported to the WHO on November 24th from South Africa. On November 26, 2021, WHO named it as Omicron, the 15th letter in Greek alphabet. Okay. Omicron is a variant of COVID-19, which comes under the name B1.1.529, which is spreading more rapidly than other strains, and it has more mutations than any other variant so far. So there is more than 30. As you can see, the image which is attached to the side, many of the mutations are in the spike protein, which relates to how the virus is going to spread. There is consistent evidence that Omicron is spreading significantly faster than Delta variant in countries with increased community transmission, with a doubling time of 2 to 3 days. The overall risk related to this variant is again very high, again, which I'm going to discuss further. How did it develop? The more the virus circulates, the more the virus will evolve, and most changes have no impact or little impact on the virus properties or behavior. However, some of the changes to SARS-CoV-2 lead to emergence of different variants that affect three things, which are again very important. Please take a note of this. It is the virus transmissibility, how the virus is going to transmit, the disease severity and how it is going to present, the effectiveness of the present vaccines, the therapeutics, the diagnostics, and obviously all the measures of public health and social health. So WHO, it has recognized and it has maintained two categories of this. So the variants have been identified and which have been characterized as variants of interest or variants of concern. So according to WHO, the variants of interest, a variant with genetic changes that are predicted or known to affect the virus characteristics, such as how it is going to transmit, the disease severity, the immune escape, the diagnostic or therapeutic effect on it, and variants of interest also cause community transmission or multiple COVID-19 cases, and obviously all throughout the world, or it's a pandemic or epidemic, or depending on how relevant it is. What is a variant of concern? So it has all the characteristics of a variant of interest, and also other characteristics like increase in the transmissibility. So it obviously doesn't respond to the proper regular protocols, so it is going to transmit even faster, and the increase in the virulence or change in the clinical disease presentation, how it is going to present, and the decrease in effectiveness of the public health and social measures or the available therapeutics, diagnostics, etc. So presently, Omicron variant is a variant of concern. How serious and how contagious is Omicron right now? So I have read a recent article from the Lancet, which was published by Nicole Walter and colleagues. So in this, they say that early findings also suggest that Omicron may be milder but not mild. So it has a proper meaning for it. So there is a reduced risk of hospitalization for Omicron compared to the previous variants like Delta. And according to the US CDC, Omicron likely spreads more easily than the original virus, and it appears to be more contagious compared to the Delta variant, and it has quickly become the dominant strain in many countries, including India right now. So the CDC said it expects the people can spread Omicron even if they're not vaccinated or don't have symptoms. How did it emerge? So the emergence of Omicron. CDC has been using genomic surveillance throughout the course of the pandemic to track these variants and the virus that causes COVID-19, and also inform the public health about what is going to happen. So on November 24th of 2021, a new variant of SARS-CoV-2, which was B1.1.529, was reported to the World Health Organization. This new variant was first detected in specimens collected on November 11th in Botswana and on November 14th in South Africa. On November 26th, WHO named this as Omicron and classified it as a variant of concern. On November 20th and November 30th, the United States designated Omicron as a variant of concern. And on December 1st, the first confirmed case of Omicron was identified in India. Right. These are findings right now. So evolution, how it evolved in South Africa, and the cases, how they are increased, and the prevalence in South Africa, which was first seen. And this is the present cases, everyday cases. UK obviously being the top, USA comes second, Denmark is the third. India is way down, but remember, these are the daily cases, which are obviously going to increase depending on the severity of the cases. So comparison with all the variants which were previously cropped up. So Delta, which was again from India, which was on October 2020. Gamma, which was in Brazil, and that is November 2020. September, the first one, which was Alpha in United Kingdom, and now Omicron, which was detected in November 2021 in South Africa. So again, I come to the same topic. The three key properties of a variant are likely to influence the overall threat. So it's transmissibility, its virulence, which is the ability to cause any severity, the severe disease, and its ability to evade the immune responses. So prior infection, vaccines, therapeutics, all these don't come to play in for the new variant, right? So again, coming to the article which I have read in Lancet, Nicole and colleagues reported data from more than 11,000 individuals, so with COVID-19 in South Africa, indicative of significantly reduced odds of hospitalization for patients infected with Omicron variant versus other SARS-CoV-2 variants during the same period. And also, they observed there were significantly reduced odds of the severe disease among patients infected with Omicron and among patients infected with Delta. So these useful findings derived from the national level COVID-19 hospital surveillance data linked with the case, laboratory, and genomic data represent a reassuring confirmation of early indicators that Omicron variant might lead to less severe disease and societal disruption, and also have a reduced effect on the hospital resources than variants which were already previously dominating the pandemic waves. So, Nicole Walter and colleagues article, which I've read, also stated that SARS-CoV-2 reinfections are milder on average than the previous infections. By the December of 2021, more than 70% of South Africans had existing anti-SARS-CoV-2 antibodies. So they already had antibodies as a consequence of already a natural infection or vaccination or whatever. So in this study, the odds of previous infection were around 23 times higher in Omicron versus the Delta variant infected patients. It could be due to the Omicron variant's capacity for immune escape that could increase the proportion of milder reinfections. Remember this, milder reinfections. Okay, so coming to how we are going to identify the symptoms of Omicron. So we don't exactly know what symptoms are going to crop up in the future right now, but presently there are mild symptoms. Again, despite being highly contagious, this particular variant causes mild symptoms, but weakness and body pains are a first of a few. The rest are headache and sore throats. Headache being again very mild to moderate headaches, but again, severity of the headaches might depend on the person who is suffering and obviously their immunity. And this again will be in the first couple of days after the infection is again into the body. Right. Again, the third symptom which I would the third symptom which I would stress upon is sore throat. So apart from mild cold and cough, patients are also suffering with throat and fatigue, which they are considered as the less common symptoms. This is again a systematic review of the symptoms which we are going to see in an Omicron case. Headache and fatigue being the top of all the symptoms which we are going to experience during an Omicron infection. Upper and lower respiratory. I've also included lower respiratory because there are cases where the lower respiratory is infected, is not major and doesn't require any hospitalization as of now. Major cases which are coming right now are cough, cold, running nose or nostrils with congestion. The other symptoms are body aches, generalized weakness, which again are a lot less than previous variants, but generally tend to continue for 3 to 4 days. Yes. So cough, cold, and Omicron. This was the name of the topic which I chose to present in the first place because of the ongoing scenario where we are unable to differentiate between who is affected with flu and who is affected with Omicron. So the symptoms of this variant, Omicron variant,
No voice.
Dr. Vivek, we can't hear you, please.
sorry for this. My Wi-Fi got cut. I'm really sorry. Just give me 1 second. Is everyone able to hear me? Anyone, you can say yes.
Go ahead, Dr. Vivek.
Okay. Okay, sir. Okay. So as I was telling, the symptoms of this Omicron variant are more or less the same as that of a common flu, which we are going to experience now and then for almost all the patients. However, there are minor differences that can make it difficult to differentiate between these two. So according to health experts, it is extremely difficult since both the Omicron variant and the common flu have common symptoms such as cough and running nose. So how can someone showing these symptoms differentiate between the two viral infections? Of course, there is one specific way, which is to get yourself tested and get the confirmation through RT-PCR. So now the flu is very common, especially in this season, and usually the symptoms are fever, headache, muscle ache, but also upper respiratory symptoms such as sneezing and coughing. For COVID-19 also, it's the same symptoms basically, but in addition, we have specific symptoms such as loss of taste and smell. And many people, especially young people, have experienced these additional specific symptoms for COVID-19. According to experts, the major symptoms in Omicron COVID-19 are fever is generally present for 1 to 2 days, then the fever goes away, and then there is strong body pain and backache, but much worse than in flu. And we generally don't see such type of complaints in patients with flu, which may be pretty severe in the first 1 to 3 days in Omicron. So sometimes people have few symptoms, whether it's for flu or for COVID-19, and it again really depends on the level of immunity, which is important to know for these two diseases, is that prevention measures work for both of them, and especially
Sir, I'm sorry to
washing
interrupt you.
hands. Yes.
Can you please share your
Yes.
screen, sir?
I'm sorry. Just give me 1 second. Okay. Is it visible?
Yes, sir, it's visible.
Okay. Okay. Right. So the major symptoms in Omicron are that fever is generally present for 1 to 2 days, as I already told you, and the back pain and severe headaches and body aches in flu patients are much less severe, but they are again severe in Omicron for the first 2 to 3 days. The patients who are experiencing these symptoms, it obviously depends on how well your immunity is, and it also depends on the preventive measures you're taking, and especially washing hands is very important. Nowadays, we're seeing people, you might be noticing it on the roads, outside. People generally seem to be very casual about the new variant, claiming that it is nothing less than a cold and that there is no need to be concerned, and just taking a few tablets might suffice the complaint. People are still roaming around without properly wearing these masks. So this is again a risky situation, because ideally, if we are nearing the end of the pandemic right now is not at all the time to let ourselves loose because of this. So there were 285,950 new cases of COVID-19 which were recorded in India as of January 27th, 2022. Now, who is at risk for flu and Omicron? So the group which are most at risk for influenza or Omicron are elderly people or people with debilitating conditions like respiratory diseases, cancers, cardiovascular diseases, and all obviously people with comorbidities like hypertension and diabetes. These are the similar group for COVID-19 as well. But for COVID-19 Omicron variant, in addition, the pregnant women and very young children are also again more at risk. Coming to our clinical case. So I'm going to start the clinical case right now. So about the patient, we are going to discuss the case history, the diagnosis, and obviously the treatment protocol. So for safety purposes and obviously for the consent purpose, we're not naming the patient. We had this patient. The patient came to our clinic recently, and and we got to take her history. So yes, a patient VL who is aged 45 years, female, she's from Manikonda, and she already took 2 doses of the Covishield vaccine and is a known case of hypertension and diabetes. Contacted us on January 4th, right? So she already had her history. She attended a party on December 31st in a closed space with 40 people. She didn't have any symptoms the next day, but the first set of symptoms started to appear on January 3rd. So we don't know what the patient is suffering with right now. So the first set of symptoms, whatever they might be, started to appear on the 3rd of January. And January 4th, this is the timeline of me talking with the patient. So on January 4th, we had a consultation over call, and obviously she described her symptoms as follows. So she had these symptoms, which are on the screen right now, as you can see. She had 4 symptoms, to be very precise. Headache, which was the main symptom, a low-grade headache with severity increasing after waking up in the mornings, which was again observed for 2 days before the consultation, and also aggravated with movement, and also had retroorbital pain. So the second symptom, which is again a very specific symptom, throat pain. This symptom started on the 3rd of January in the morning as soon as she woke up. The third symptom is fever, and she had fever in bouts, but the highest was reaching around 102 degrees Fahrenheit with aggravation in the night, during sleep, and also at rest, but was better with warmth or hot vaporization. And the fourth symptom is cough, which again developed on the 3rd of January with mild runny nose, which was also enough to cause panic, which was again aggravated in the night. The case history, as you can see, she didn't have any mental symptoms as such as of now, but she was really anxious. She was restless. There were no specific dream sequences as such. Her appetite was good. She is a non-vegetarian, and but the first 2 days, the appetite was really low. She couldn't eat anything. Thirst, she generally has a little amount of water, but we advise to drink more amount, and her bowels and urine were completely normal. Her sleep was not good. It was not adequate, and she had only 5 hours of sleep before the date of consultation. She didn't have any habits of tobacco chewing, smoking, or alcohol. So she had a past history of renal calculi, which was in 2015. She did not take any homeopathic medicines. She underwent lithotripsy. You know what is lithotripsy, which was performed 2 years ago for both kidneys, bilateral renal calculi, and there were no recurrence until now. No specific family history, but both father and mother are hypertensive, and the mother is also diabetic. She didn't have any specific cravings or aversions as such. So she is a known case of hypertension, and she has been using antihypertensives, which is Tema-20, since 8 years. And she's a known diabetic since 6 years and is on oral hypoglycemics. And she doesn't have any addictions. Now, coming to the investigations part. So after discussing it with the patient, after knowing about all her symptoms, we advise the patient for a series of tests, which we generally advise to all our patients. CBP, CUE, CRP, fasting blood sugar, COVID rapid antigen, and COVID RT-PCR were also advised, obviously, because of the ongoing scenario which is happening right now. So the reason for advising the patient to go for both rapid antigen as well as RT-PCR was the confirmation through RT-PCR when the rapid antigen shows false negatives. Coming to our next slide. See, so RT-PCR remains again the gold standard for COVID-19 strains. The diagnosis part. So surprisingly, we were actually surprised because the patient's COVID rapid antigen test was negative. We didn't want her to go to an RT-PCR test, but we actually wanted to confirm it. So we went for the RT-PCR and it turned out to be positive. So after which we again told her about all the precautions, like isolating herself, wearing a mask, taking a lot of fluids, especially we generally advise in our clinics to take a lot of fluids, especially lots of juices, water, and obviously eating a lot of nutritious food, which are again rich in antioxidants. Resting well is again the main most important aspect of advising any patient, because resting reduces half of your complaints, and obviously quarantining herself for 10 to 14 days. So we didn't have any specific protocol for this, so we already followed the regular COVID-19 protocol. Now coming to the treatment part. This was slightly tricky. Since this was the first case of COVID-19 in 2022 with Omicron symptoms, our treatment protocol was slightly changed according to the patient. So our protocol was as follows. Arsenicum album 200, which was given 2 doses, which is again a very preliminary dosage in all our clinics. The doses should be taken with a gap of 10 hours in between. As we already know, this has been advised by a CCRH and also Ayush department that arsenic album 30 is used for a preventive. So we gave her a dose. We gave her 2 doses of arsenic album 200, which should be taken with a gap of 10 hours in between. So next day, Rustox 200 was advised for that patient, which we gave Rustox 200 as well as Bryonia alternating. So Rustox 200 was given 5 doses, Bryonia 200 was also given 5 doses, and Rustox was asked by the patient to take every morning 1 dose for 5 consecutive days, and Bryonia we advised the patients to take it 1 dose every night for again 5 consecutive days. These all were again complemented with Bacteria. Bacteria, as you all know, is a it is one of my favorite drugs right now. We give generally Bacteria in mother tincture form, which is again, even though it is a very low potency, it has high efficacy for any infection and fevers. So the Bacteria complements all the said drugs which have already told you: arsenicum album, Rustox, Bryonia. Bacteria really complements all these. So we ask the patient to take 20 drops of Bacteria mixed with around half a cup of water in the morning, in the afternoon, and in the night. We have a system in our clinics which was developed by my grandfather, Dr. Shivshankar Karo, to provide patient with emergency medicines. So they don't feel the need to start using any conventional allopathic medicines during our course. So this helps the patient to stick with our protocol. We have seen many patients eventually shifting their course to antibiotics or using a lot of other antipyretics like Dolo, paracetamol, without the use of our emergency medicines. So we have been really trying hard to communicate with patients and stressing on the fact that antibiotics don't work for a viral infection. And them would mean that they would just suppress the complaint, which would again crop up later with a greater vigor. I have previously made a small video regarding this, stating how antibiotics and how antivirals work and what how big the bacteria are. So generally, what happens is the bacteria are obviously larger than the virus. The virus cannot, the bacteria cannot penetrate the cell membrane, so it sits on the cell membrane. But the virus can penetrate it. It can go directly into the nucleus and it starts mutating. That is what is happening right now in all the cases. So when you give an antibiotic for a viral infection, it doesn't penetrate the cell membrane. It can't penetrate the cell membrane. So what it's going to do, it is going to kill off the whole cell. And also, when you take an antibiotic for any viral infection, let it be common cold or Omicron or COVID-19 or whatever, it is just going to suppress your complaint. And at the same time, it is not only going to kill the infected cell, it is also going to kill the healthy cells around it. So what is going to happen eventually? You're going to fall a prey for antibiotics. You generally develop a lot of weakness even after your antibiotic course is done. So this is a trend which we have observed in all the patients who have taken antibiotics for viral infections. Okay. So coming to the emergency medicines, we provided a set of emergency medicines for the patient. They are again as follows. So we gave the patient belladonna 200 and pyrogenium 200 for fever. So we asked the patient to take one dose every 4th hourly when the temperature of the patient remained below 101 degree Fahrenheit. And some patients generally panic when they have fever, and which generally crosses when it crosses beyond 101. So we generally ask them to take a paracetamol if it crosses 101, because some of the patients, they don't even tell us when they are going to take any antipyretic or antibiotic along with the course. So we advise them beforehand so that they don't fall a prey for antibiotics. And also paracetamol generally doesn't cause any sort of any major side effects. So it is generally going to reduce the intensity of the fever. So we generally ask them to take only if it crosses 101 degree Fahrenheit, which has never happened until now, because belladonna and pyrogenium they work excellently for fever, and that's the reason we give this emergency medicine for fever. And the second set of emergency medicine which we give is Hepatitis 30, which is for both cold and cough. And again, we ask the patient to take one dose every 6th hourly, only when the cough is high and not getting control even when using the regular course. The third set of medicine is Gelsemium 200 for headaches. It generally, the patient, when he or she starts our treatment, they generally get better within the next day. But we generally give Gelsemium 200 for headaches because it works excellently for headaches, especially along with this course, which should only be taken during severity. So we monitored the patient in the coming days. So we were continuously in touch with the patient. The first 3 days, so I divided all these into the next 10 days. So the first 3 days, the patient had headaches. So it was again 75% of it. 40% of it was sore throat, fever, and cough. But fever was not major. The sore throat and cough generally tend to irritate the patient. So again, while the course is going on, the next 3 days, the patient was 50% better in the terms of sore throat, and she had only 20% of cough. The last 3 days, she had completely no symptoms as such, but she had occasional cough, which is again the main symptom of Omicron. Coming to what you need to do and what you shouldn't do. So as you can see on the screen, it is obviously well-known fact that washing your hands frequently is the main thing which you need to do. Informing as soon as you have symptoms, staying home and quarantining yourself, drinking lots of fluid, especially water, and eating good and nutritious food. The things which you shouldn't do is obviously touching your mouth, eyes, and nose. Traveling to the places or traveling to your relative's place or any place which is already infected, or going into closed and crowded places and not wearing a mask. The first thing which you need to stop doing is panicking, because again creates a lot of stress. It is not a stress just for yourself, but also the people around you. And sharing unknown information, sharing news from all the sources which you obviously don't know. Coming to the prevention part, again, we are stressing about this a lot, but Delta and Omicron, they have again the same preventive measures. Obviously, for any particular virus right now, keeping a physical distance, wearing a good mask, and obviously being in places which are well ventilated will reduce half the risk. And washing your hands frequently and coughing or sneezing into your bent elbow is the best thing to do. Now, patients generally ask me whether they should be traveling to any place or traveling outside of the country. So WHO, so this is a slide which I've taken from WHO's site. So this particular slide is a risk-based approach to international travel. So what they have specifically said in this is that in emergence of Omicron, many countries have reintroduced this travel ban. You might be knowing about this, right? So the travel bans will not prevent international spread. Okay, will place a heavy burden on the lives and livelihoods and may desensitivize countries to report and share epidemiological data. I completely agree with this because travel bans are not at all a way to prevent an international spread. An evidence-informed and a risk-based approach to the international travel should be applied in context of COVID-19. The travel for essential products, obviously, purposes like essential personal, goods, cargoes. Obviously, it is needed. So this is a slightly controversial topic, but I'm going to talk about this. So are the present COVID-19 vaccines effective against the Omicron variant? So this is again a report by WHO that researchers are looking into any potential impact the Omicron variant has on the effectiveness of COVID-19 vaccines. Information about this is again very limited, but the vaccine is not preventing any mild disease and infection, and there may be a reduction in the effectiveness of vaccines against the severe illness and death. However, WHO also states that the current available vaccines offer protection against severe disease, which cannot be spoken about as of right now. Our homeopathic medicines, they work really wonderfully for reducing any sort of associated symptoms and also help in increasing the immunity, as you very well know about it. Okay. Is a prior COVID-19 infection effective against the Omicron variant? You might have already got this doubt. Many people might have got this doubt. So, WHO again reports that early evidence suggests that previous infection could offer less protection because obviously Omicron has a lot of mutations. It is completely different from what other variants are. So, especially the variants of concern like Delta. So, while people who recover from COVID-19 may develop some natural immunity to the virus, we do not yet know how long it is going to last or how well you are protected. So, there are homeopathic medicines again come into play for increasing your natural immunity and against any infection. And everyone here knows about it, that there are no side effects at all. So, coming to the conclusion part, taking the present situation into consideration, Omicron appears to be milder, but is not mild, with less hospitalizations and less severity. But COVID-19 pandemic is far from over, with reports suggesting that there may be more variants which are again going to crop up, which might not be necessarily mild. So continuing the regular safety protocols is of utmost important. This is really important, and a high degree of suspicion should be present when having even mild symptoms like cold and cough. At present, any cold and cough should be considered as COVID-19, which is again said by WHO until proven otherwise. Prevention is always better than cure. These are the references. Thank you so much. Thank you so much for this time. Does anyone have any questions? We shall be discussing about this.
Thank you, Dr. Vivek. We request the audience to post their questions. Ask Dr. Vivek on this topic, which is the event of the time as of now.
Anybody? Anybody, any questions about anything?
We request Dr. Sivshankar sir to say a few words, sir.
Am I audible?
Yes, please go ahead, sir. Thank you.
Thank you, Dr. Venugopal. Actually, I'm slightly indisposed. I'm not in a very good moods to participate in the discussion, but it was exhaustive coverage was given by Dr. Vivek, and because this variant is slowly coming down in severity, and the fatality rate is drastically coming down. And let us hope for the best. It will further come down. And homeopathy is really playing a very vital role. As all of you know, for viral infections, homeopathy is the best line of treatment. This has been proved time and again for the last so many decades. But still people are ignorant. Many people are ignorant and not utilizing the services of homeopaths for the benefit of them. And now homeopaths also have a responsibility of creating awareness, and government agencies have got a responsibility to create a sort of consciousness among the people to try homeopathic medicine, which is definitely cost effective, sans side effects, and very effective therapeutic measure. So all these things have been explained by Dr. Vivek, and I congratulate the young man for his very excellent oration. And I thank Hamad for giving an opportunity to young homeopaths to get themselves acquainted with the professions. Thank you.
Thank you so much, sir. Sorry to disturb you when you were indisposed, but seeing you there, we always get tempted to hear a few words from Dr. Manoj.
Good evening, everybody. Sir, good evening. Am I audible?
Yes, sir. You're audible, sir.
Dr. Manoj, we are unable to hear you, please. Your mic seems to be switched off. Yeah.
Am I audible now?
Yeah, very much. Please go.
Yeah. Thank you so much. Good evening, everybody. Good evening, Shivshankar Garu, Dr. Vivek. Thank you so much for the lecture. This is probably one of the first time I've sat through an entire lecture. And this was clearly because there was a lot of honesty in your presentation. And I must admire you coming up with the complete protocol very honestly, unlike most people who just come up with a single drug and most of it is not revealed. I'm very happy to know that youngsters like you are coming up honestly and openly with what you're doing in the clinic. I can already see a chat saying, why can't you minimize the number of drugs and treat? I'm sure a lot of questions will come up like this, but I think it's very nice to see you guys being doing an honest presentation. As this is the first time, I really enjoyed your lecture. Thank you so much.
Thank you, sir. Thank you so much. Thank you.
Kind words for our speaker. Thank you, Dr. Vivek. It was a very entertaining and a thorough session of what is going on with the new virus. And how do you think this virus is going to take its shape in the days to come? What is going to happen with this pandemic? What do you think are the probabilities?
Okay, so we obviously pretty well know how the course is going on right now. But I feel the people should be more careful rather than careless right now as they're being outside. That is the first thing which I expect from all the people who are right now viewing this. I advise all the people to tell this to all others also. We pretty well know about it, but our population is not like that. So whatever the case, whatever the variant might be, if if we are if we are going to treat it properly, if we're going to take regular precautions, if we are going to treat it properly with not just our medicines but with our immunity, so I feel that it is going to take a good turn. Right now, we feel that it is a good thing that Omicron is actually causing less symptoms. But I feel that if the virus is mutating and if it is going to take a different turn, then the consequences might be again different, because any mutating virus, we don't know how it is going to respond to any of our protocols, or for that matter vaccines, or whatever is going to develop. Because right now the vaccines are just 10 to 15%, there's only a 10 to 15% efficacy for this particular Omicron variant. So I don't feel that we need to go stress about vaccines or what we need to do, but we have to stress about how people need to be more precautious, and how not taking this virus lightly. Even if it is cold and cough, you should be able to take it with a pinch of salt. So this is what I feel. So this is what my take on this is. Sir, we are unable to hear you.
Sorry. Do you think, Dr. Vivek, the pandemic has come to an endemic stage, or do you think there are more mutations around the corner? What is your prediction about the
Sir,
things?
I particularly feel that see, with any virus for that matter, if we take the course of the history, all the viruses which have cropped up previously also, they have mutated a lot. But it is all up to see, getting afraid for small things is not obviously what we need to do. But I feel that it has reached an endemic stage, but it is only again confined to the country which we are living in. So if we consider that it is endemic, it is going to be an endemic, but it all depends on the person's perspective.
Thank you, Dr. Vivek. I request our President, Dr. Gopal Krishna sir, to say a few words, sir.
Am I audible?
Yes, sir.
Hello, thank you, Venu. Yeah, it was a very interesting and knowledgeable session. I congratulate Dr. Sai Vivek for his very informative talk. So I would like to know whether, apart from arsenic alb, anything else would help in preventing an attack for future. You have any suggestion in regards to that?
Okay, so we have, along with my grandfather, Dr. Shankar Garu, we have already tried a few medicines, but nothing can beat ourself. So ourself 200 is the best as of right now. But we are also thinking about, not just preventing, but we have also had this doubt in our mind that Baptisia is definitely working for all the cases right now which are prevalent right now. So that's the reason we have included Baptisia in our regular protocol, because Baptisia works along with all the medicines which I have mentioned, which is arsenic album, bryonia, rustox, belladonna. But along with that, Baptisia generally does not it helps in reducing the infection, and obviously all the other symptoms of fever and other complaints get reduced. So I feel that Baptisha is not properly used by all the homeopaths, but I feel Baptisha has the potential to not just prevent, but it is a curative aspect also.
Yeah. Thank you, Dr. Vivek. So in the past, in regards to viral encephalitis, tuberculum at the end was given or suggested, and we found no recurrences or less recurrences later. Or can we consider any such nosode at this point of time after arsenic?
Okay, sir. So presently we are, as I've shown you in the protocol, we're already giving a nosode which is pyrogenium.
Okay.
So it is definitely working for any sort of fever, and it is excellently working, especially for fevers which are high grade, especially for fevers which are 100 or 101. So this might be a very good a very good step towards generally curing that patient. So pyrogenium is definitely my take on this nosode.
Right. Thank you, Vivek. Thank you for your knowledgeable talk.
Thank you.
Thank you very much.
Thank you so much, Dr. Vivek. And adding to what Gopal Krishna sir just said, when we had a session on COVID-19 about a year ago, Shiv Shankar sir was suggesting tuberculum to be given in post-COVID stages to see that the bad effects of the virus are removed, and also probably tuberculum is a better remedy for the sorosyphilitic manifestations of this virus. I think it comes at a right time, sir. Thank you so much. Thank you, Dr. Vivek. That was a very useful and informative session. We hope to hear more from you in the time to come. This is the beginning of many talks to come, we would like to imagine.
Sure,
I request the advisory group, Dr. S.K. Vashishji, to say a few words and present vote of thanks, sir.
Probably I'm audible.
Yeah, very much.
Congratulations, Dr. Sai Vivek. Really, you have made us proud by the talk
Thank you,
you given on Omicron. And I'm really proud that the way you have prepared the article, we appreciate the hard work, what you have taken in preparing it, because as far as this disease is concerned from last 2 years, we are knowing more about it from the media. And I feel sometimes, well, it's just a joke, like it's just like a film poster. See, before the disease comes, 1 week or 2 weeks before that, it comes in the paper that yes, Omicron is coming. And then they talk about some symptoms of it. And what I've seen is it's more the fear what has been created and the panic. And I appreciate the way you have given the protocols and the way you have been following it up. And as it is, I look forward to you and colleagues like you, that as on today, what I have observed personally is in this management of Omicron is that homeopathy, we need something like a substitute for a dolo or crocin.
Very true, sir. Very true.
So once, if you take that up, probably in fact, since Dr. Manoj is also sitting here, I just want that other than saying that you take belladonna or pyrogen every 4 hours as an emergency, see, we definitely need, because in homeopathic is the only system of medicine which has, so many drugs what we are having. See, we are having almost 5,000 to 6,000 drugs which no other system of medicine has. We have biochemic tissue salts. We have homeo tablet, homeo triturations. We have mother tinctures. So with so much range what we are having, so I personally, in fact, I take this opportunity in requesting you to just work on to that we should have something where we should be able to substitute medicines like Dolo. And if you have gone through the newspaper, probably the manufacturers of Dolo, they had made millions. This is the only drug which has been sold from last 2 years. So once again, I thank you and God bless you. And
Thank you, sir.
I appreciate you and wish you all the best. God bless the day.
Thank you, sir. Thank you so much.
Thank you.
Thank you so much, Vashish sir. Thank you so much to the audience and the sponsors of this oration, Veni Bhushan Memorial Oration, the speaker, Dr. Sai Vivek, and all of you for being here to attend this informative session. We look forward to seeing you again very soon in the month of February for Dr. Seshachari Memorial Oration. Till then, goodbye.
Thank you again, sir. Thank you so much, everyone.
Thank you.